Do you have diabetes or suspect that you might have it? If so, you probably know that this condition can affect your blood sugar levels throughout the day. But did you know that it can also cause some unusual symptoms at night? In this video, we will reveal 7 diabetes nighttime signs that you shouldn't ignore. These are unpleasant and sometimes dangerous symptoms that can disrupt your sleep and affect your health. It is very important that if you have some of these signs to talk with your doctor. So without further ado, let's get started. Number 1. Nighttime urination. It's normal to need to pee once or twice during the night, but if you have to do it more often, you may have nocturia. Nocturia is the medical term for getting up at night to go to the toilet. There are many possible causes of nocturia, such as drinking too much fluid before bed, having a urinary tract infection, taking diuretic medications, or having prostate problems. But one of the most common causes is diabetes. So what does diabetes have to do with peeing at night? Well, when your blood glucose levels are too high at night, your kidneys have to work harder to get rid of the excess glucose. This forces them to make more urine. The more urine you make, the more often you need to pee. And this doesn't stop when you go to bed. In fact, when you lie down or raise your feet up, fluid that was stored in your legs during the day is absorbed into your bloodstream and removed by your kidneys. This increases the need to urinate at night even more. So how can you prevent or reduce nocturia caused by diabetes? The best way is to keep your blood glucose levels under control. This means following a healthy diet and taking your medications as prescribed. The other way is limiting your fluid intake in the evening, especially drinks that contain caffeine or alcohol, and trying to empty your bladder completely before going to bed. Number 2. Frequent thirst. Like what we said, when you have too much glucose in your blood at night, your kidneys try to filter it out and pass it through your urine. This makes you pee more often and lose water from your body. As a result, you feel thirsty and need to drink more water to rehydrate. But drinking more water also makes you pee more, creating a vicious cycle of thirst and urination. This cycle can be worse at night, when you're sleeping and not drinking water for several hours. You may wake up feeling parched and need to drink a glass of water before going back to bed. Or you may have trouble falling asleep because of the urge to pee. Either way, your sleep quality can suffer and affect your mood and energy levels the next day. To avoid this, you should drink enough water throughout the day to stay hydrated. But avoid drinking too much water right before bedtime, as this can make you pee more at night. You can also limit caffeine and alcohol intake in the evening, as these can dehydrate you and make you thirsty. Remember that nighttime frequent thirst is not just a nuisance. It's a warning sign that your blood sugar levels are out of balance and that you need to take action to control your diabetes. Number 3. Night sweats. You know, those annoying episodes when you wake up in the middle of the night soaked in sweat and feeling shaky, hungry, or confused. So what's going on? Well, night sweats are often caused by low blood sugar at night, also known as nocturnal hypoglycemia. This happens when your blood sugar levels drop below the normal range, which is usually between 70 and 130 milligrams per deciliter. When this happens, your body releases adrenaline, a hormone that helps raise your blood sugar back to normal. Adrenaline also causes other symptoms such as sweating, increased heart rate, anxiety, and nervousness. But why does your blood sugar drop at night? Well, there are several possible reasons, such as taking too much insulin or diabetes medication before bed, not eating enough carbohydrates during the day or before bed, or exercising too much or too close to bedtime. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 4. Sleep apnea. Sleep apnea is a disorder that occurs when your airway becomes blocked or narrowed while you sleep, causing you to stop breathing for short periods of time. This can happen hundreds of times a night, disrupting your sleep quality and oxygen levels. Sleep apnea is more common in people with diabetes, especially type 2 diabetes. According to some studies, about 71% of people with type 2 diabetes may have sleep apnea. This is much higher than the general population, where only 4 to 10% of people have sleep apnea. But why is that? Well, there are several possible reasons. One of them is obesity, as being overweight or obese is a major risk factor for both diabetes and sleep apnea. Excess fat around the neck and abdomen can put pressure on your airway and chest wall, making it harder to breathe at night. Another reason is that diabetes can damage the nerves that control your breathing muscles, especially if you have poor blood sugar control or long-term complications. So how do you know if you have sleep apnea? Well, the most common signs are loud snoring, gasping or choking sounds, pauses in breathing, restless sleep, morning headaches, and daytime sleepiness. The most common treatment for sleep apnea is continuous positive airway pressure, which is a device that delivers pressurized air through a mask that you wear over your nose or mouth while you sleep. This air helps keep your airway open and prevents it from collapsing. Number 5. Nightmares. Have you ever woken up from a nightmare feeling sweaty, shaky, and hungry? If you have diabetes, you might have experienced a low blood sugar episode during your sleep. When your blood glucose drops below 70 milligrams per deciliter, your body releases stress hormones such as adrenaline and cortisol. These hormones trigger symptoms such as sweating, trembling, heart racing, and anxiety. They also stimulate your brain to produce vivid and scary dreams that may wake you up or make you feel restless. Nightmares caused by low blood glucose can affect your quality of life, mood, and ability to work. The best way to prevent them is by preventing your blood glucose from dropping too low during your sleep. So, check your blood glucose levels before going to bed and during the night if you wake up. Also, avoid skipping meals, especially dinner. Eat a balanced meal that contains carbohydrates, protein, and fat to keep your blood glucose stable throughout the night. Number 6. Dry mouth. Dry mouth is a condition that occurs when your salivary glands do not produce enough saliva to keep your mouth wet. Like what we said, diabetes can make you urinate more often, which can lead to dehydration and dry mouth. This is especially true if your blood sugar levels are high and not well controlled. When your blood sugar levels are too high, your body tries to get rid of the excess glucose through your urine. This can also cause dehydration and dry mouth. High blood sugar levels can also damage the nerves that control your salivary glands, reducing their ability to produce saliva. Other than that, diabetes can also affect your kidney function over time, which can also cause dehydration and dry mouth. The good news here is that there are some simple steps you can take to keep your mouth moist and comfortable. The important one is to drink plenty of water throughout the day to stay hydrated and replenish the fluids you lose through urination. You can also chew sugar-free gum or suck on sugar-free candies or mints to stimulate saliva production. And finally, use a humidifier or vaporizer in your bedroom at night to add moisture to the air. This can help prevent your mouth from drying out while you sleep. Number 7. Difficulty sleeping. If you have some of these annoying nighttime symptoms we talked about earlier, it might be very hard for you to sleep or stay asleep. In fact, sleep problems are very prevalent among people with diabetes. According to a study by the American Diabetes Association, about 40% of people with type 2 diabetes have poor sleep quality and 16% have restless leg syndrome, which is a condition that causes an irresistible urge to move your legs, especially at night. These nighttime symptoms can happen when your blood sugar is too high or too low. When your blood sugar is too high, it can make you feel thirsty, hungry, or need to urinate frequently. These sensations can disrupt your sleep and make you wake up during the night. On the other hand, when your blood sugar is too low, it can trigger a stress response in your body that releases hormones such as adrenaline and cortisol. These hormones can cause nightmares and make you feel anxious, nervous, or sweaty, which can also interfere with your sleep. The most important thing here to prevent all these symptoms is to monitor your blood sugar levels regularly and keep them within your target range. This will help you avoid both high and low blood sugar levels that can disrupt your sleep. Also, try and exercise regularly during the day, but not too close to bedtime. Now, we want to hear from you. Did you have some of these symptoms before? Was it actually diabetes causing them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.